Hey, Dr. Karan again. So I'm in between my patients. I thought maybe I should talk about Ozempic and similar medication because I get to see every day at least three patients, and why not pass on some information to you guys? So, purpose is education and to empower you guys with some basic information. So, if you are considering or have been prescribed Ozempic or Wegovy or Zepbound, Mounjaro for weight loss, it's important to understand how these medication work and what to expect and how to use them safely. Both are injectable medication originally used to manage type 2 diabetes but are now approved or prescribed off-label for weight loss in certain individuals. So what are Ozempic and Mounjaro? Ozempic is semaglutide. Ozempic is GLP-1 receptor agonist, a medication that mimics a hormone called glucagon-like peptide, GLP-1. GLP-1 plays a role in regulating blood sugar, insulin levels, and appetite. It helps the body lower blood sugar and can reduce appetite, leading to weight loss. Mounjaro, Tirzepatide. Mounjaro, is a dual agonist. It targets both GLP-1 and GIP, which is glucose-dependent insulinotropic polypeptide receptors. By acting on both these hormones, it enhances blood sugar control and has more potent appetite suppressing effect, which can lead to significant weight loss. And both medications are injected once a week and have been shown to help with the weight loss in people with or without diabetes, particularly those who have struggled to lose weight through diet and exercise alone. And how do these medications help with weight loss? The weight loss effects of Ozempic and Mounjaro come from their ability to suppress your appetite. These medications slow down how quickly the food moves through your stomach, making you feel full for longer after eating, which reduces overall food intake. It also reduces cravings. They help reduce hunger cravings, making it easier to resist overeating or snacking between meals. It regulates blood sugar, although primarily used to control blood sugar in diabetics. These drugs improve metabolic health, which is often linked to weight loss. Increase satiety hormones by mimicking GLP-1, and in case of Mounjaro, GIP as well, they enhance the body's natural satiety signals, making you feel fuller after a small amount of food. And who can benefit from Ozempic and Mounjaro for weight loss? It may be prescribed to people with obesity, those with BMI of 30 or higher, even if they don't have diabetes. Overweight individuals, those with the BMI of 27 higher, who have weight-related health problems for like hypertension, sleep apnea, heart disease, diabetes. Patient with type 2 diabetes. Since these drugs were originally designed to manage blood sugar, people with both diabetes and weight loss goals may benefit the most. So, how to use these injections? Both are self-administered medication injection, typically taken once a week under the skin. You can inject the medication into stomach, thigh, or upper arm. Rotate the injection site each week to avoid irritation. Make sure you take your dose on the same day each week around same time of the day, with or without food. In case you miss a dose, take it as soon as possible within 5 days of missed dose. If more than 5 days have passed, skip the missed dose. Dosing schedule, usually talk to a doctor. I usually start with the lowest dose and I go up depending upon two things. the side effect or the appetite's suppressing effect. If the appetite is suppressed, that should be the goal, the minimum dose which suppresses your appetite optimally. That should be the dose. Or in case patient has side effect, nausea and vomiting, I usually give patient a Zofran tablet to carry because it varies quite a bit. Some people have quite a bit of nausea even with the smallest dose. Mounjaro, the weight loss with Ozempic and Wegovy is about 12 to 15% of body weight. But with the Mounjaro, it has been reported that patient can lose up to 20% of body weight. Most of the people start seeing weight loss within first few weeks, but some people don't because they are not paying attention to what they eat, and they have a compensatory behavioral changes. They start eating more sweet food and sugary food, and they feel that medicine will take care of their weight loss, but that doesn't happen. I would say 50% of my patients, they have not lost weight. 50% have lost quite a bit of weight. So behavioral change is very important. You have to change your eating behavior. Otherwise, you're gonna end up getting all of them back later on. Side effects, nausea, the most common side effects, vomiting, diarrhea, constipation, bloating, stomach pain, sometimes pancreatitis, which is a severe pain in the mid-abdomen that requires emergency room visit and checkup. Gallbladder problem may get worse. Some rare cases, thyroid tumor. Like Ozempic, so thyroid test has to be done and has to be followed through with the doctor. Lifestyle and diet after starting treatment. Balanced diet is very important, focusing on high protein, high fiber, high good fat diet, avoiding sugary foods, sugary drinks, even the diet drinks. Portion control is very important. Since your appetite will go down, portion size is very important. You got to avoid overeating. Some activity and exercise are very helpful. If you have diabetes, then you need to check your blood sugar often. We don't want to have hypoglycemia. Gotta check your kidney and liver and thyroid function. When to seek medical help? If the stomach pain is severe and doesn't go away, persistent vomiting and diarrhea, and things like that, talk to your doctor. Your doctor is the best source of medical information. Thank you for watching.